important to maybe define what street medicine is. We generally think it's the bringing of medical, ultimately health care, directly to those that are living outside. So we focus on the unsheltered, rough sleepers, pavement dwellers, whatever your terms are.
Part of what we do is we make relationships, and even if the encounter, if all we do is give someone socks and snacks and ask them how their day was, this is part of the humanitarian solidarity that is street medicine, because we do this every week, we maintain that consistency, and maybe 6 months later they'll trust us enough so that we can actually be let into their world to provide medical care for them.
They're heart and soul bearing, right? It's usually easy for us to do. We feel strongly about it, so we open up, we share, and we can do it with great conviction. But how well is it always received on the other end?
As you all know, the flow of care on the street is very different than the flow of care in the office. And one of the issues that we found that is particularly challenging is that at any point in an interaction or an encounter, you should be able to go anywhere in the record. So if the patient says to you, well, here's my name, and then immediately you get the idea of what the diagnosis is, you should be able to put that in so that the whole record keeping is under a minute.
Initially, as work, as it gets closer to their housing, we just probably daily follow up. When they're housed, we feel where they're at with the comfortability of us visiting them, but constant follow up, a lot of case management with Ed, going shopping, seeing how they're doing. Some just resist right off the bat. You know, first night, second night, they don't stay. We have one guy that a month now. I don't think he stayed there a couple times.
Very interested in continuing to expose the traffic in children from Bangladesh, and so I thought I could do that as well from Calcutta. The government didn't like that in Calcutta, and they didn't like it in Delhi, but I persisted, and I got it out in the open. We got some of those arrested in Bangladesh.
There may be angels among us of whom we are not aware. Is he only a hobo, or perhaps is he much more?
You know, if I took a snapshot of a situation in the early 90s, and if you looked at and you asked folks how they were relating to housing as a possibility, you'd get the majority saying no, or yeah, like this or that. But you saw a lot of folks that, probably over 50%, that just weren't going to buy into it. And I've come to realize that that's really not the case after 20 years. We've housed over 800, facilitated the housing in apartments of over 800 chronically homeless people in the last 8 years. And we keep about 75 to 80% of them in their housing. That's been a long learning curve to do that.
We have an amazing staff that washes all the sheets and the pillowcases every night, so they've got fresh ones every day.
Bed bugs?
We have had problems with bed bugs in the past, and that's one of the reasons why we used to have wooden bunk beds, but because of that problem, we got rid of them and got these instead. We have the plastic kind of type mats. We don't have to worry about that. There's, of course, still problems with that, but they will actually come in and bomb the shelter once a month, and then, of course, if we see or hear a problem about it, they'll do it more often.
Our rapid rehousing program is amazing, going along with the Housing First. They got over 700 families into housing just last year, and in the month of December they got 50 families into housing. We just got notification today that we have outreach programs for our chronic homeless, and they got 30 individuals into housing, which is unheard of. So it's really amazing the team we have. The team we have here really genuinely care about these people. They go out, outreach to them, and find them the services that they need so that they can get into the housing. And then our rapid rehousing program, we're always constantly trying to work with our families to get any kind of assistance that they can get. Our case managers will often be driving them around looking at apartments all day long. Our staff here really is amazing, and we truly believe in Housing First.
Someone once said, no one can carry another's burden any more than they can run another person's race. But for some reason, when humans share, when they connect, they make each other stronger. solving the world's greatest challenges, every time you read the news or hear the news, it gets harder. But can it be done? And I think it can.
And this is key. And you know, one of these things that you just have to mention out loud is a lot of people come out to volunteer for a lot of different reasons, and you just have to get an idea of what those reasons are and make sure that those reasons are reasonable.
We provide bedding, food for supply. We have an emergency pantry. Yeah, bedding, all the things for the apartment free of charge. We go out shopping for that. That's always kind of fun too. And then we have an emergency pantry for those individuals who do not have income. And then we also try to provide them with resources and get them out in the community to, help themselves too as much as they can.
The humanness that you're bringing to the streets, is something that's going to be long-lasting and it's going to have fruits in and of itself.
My point here is really just that the notion of human rights is not something new. It's something that has been with us for a long time and is deeply ingrained in our culture and in our politics.
How are people interacting? I'm a social worker, so I think in terms of systems, how are people interacting? How are they not interacting? What's there, what's not there?
I can raise money, I can go out and talk to groups, have a newsletter, but we have this untapped source. And I love that quote where you said, I may not be able to find a house, I can't cure you, but I can be your friend. And that companionship team. I need, I guess as an educator on a book, I want you to say boom, 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 and I'll fill in the boom booms, but I need something, I need nuts and bolts.
I live in Pasco County in Florida, and the Public Defender's Office, which is who I work for, and the Commissioner purchased a mobile medical unit, and we've been going out about 3 times a week into the community providing care to the homeless and in the uninsured. So we're here to learn more on how we can do things better, what's worked for other people and what has not worked.
These are my people. This is what I love and what I'm most passionate about in my work. And coming to the conference is both a way to learn about what others are doing in this field, and also a way of rejuvenating and refilling my spirit to continue doing the difficult work that I do in Atlanta.